for the AKT inhibitor, as far as FDA-approved options, of course, we really have one option right there that is going to be FDA-approved and on label for AKT and PTEN right now, and that drug is Capivasertib. As far as PI3 kinase targeting options, we still have the drug Alpelisib. There are newer drugs coming into this class, but Capivasertib absolutely can be used in that setting as well. So, as you mentioned, we know that a PI3 kinase mutation can infer some more aggressive disease biology. Now, how common is that in this hormone-positive, HER2-negative breast cancer population? What's the incidence of PI3 kinase mutations?
We know that PIK3CA mutations are very prevalent, right? So about 40% of hormone receptor positive metastatic breast cancer patients are going to have a PIK3CA mutation. The incidence of AKT and PTEN mutations are much lower, about a handful, 2 to 3% of patients for those mutations. So those are much less frequent. In terms of agent selection, the PI3 kinase inhibitors like Alpelisib and Inavolisib are really limited to patients with PIK3CA mutations because they inhibit the PI3 kinase directly, whereas AKT inhibitors, which work more downstream, inhibit the pathway at a central node. So patients who have PIK3CA mutations, PTEN mutations, AKT mutations all qualify for AKT inhibitors, which inhibit the pathway at the central node.
Yeah. An important point that probably gets lost a lot is just when you're thinking about this mutation in breast cancer, you can just look back at a slide sometimes, remind yourself of that biochemical pathway that we have PI3 kinase here at the top, and then, AKT and PTEN, and they have different functions, of course, AKT being mostly a gain of function, where PTEN being a loss of function. And then they all kind of centrally go towards your mTOR 1 and 2. As far as causing the cell to signal. And so, that's an easy way to just look at that quickly and remind yourself that the Capivasertib, which is an AKT inhibitor, can work on all three mutations, the Alpelisib, the Inavolisib, and some of those newer generation PI3 kinase mutations are not going to work when you have an AKT or a PTEN.
Right.
Yeah, or mTOR.